Hello everyone. Today my team members and I will do a speech about the role of leadership in healthcare. In this course, my team members and I will present our thoughts and application on leadership in the form of the presentation. Next, let me tell you about this incident. A few months ago, a patient with advanced lung cancer came to the hospital. After the hospital doctor and various physical tests, as the hospital doctor had to issue a critical notice to this patient. This doctor slowly told to the patient that the patient only had half a year to live. On the report of the head nurse and the attending physician, the hospital leaders decided to provide the patient with all possible medical support and humanistic care. If you stand in the position of hospital leaders, what kind of arrangement should be given to the patient?
Hi, my name is Zixuan Zhou. First, let's look at what makes someone the right person to lead this situation. I summarized the following 4 points. These are integrity and authenticity, empathy and emotional intelligence, effective communication, and a clear mission and vision. The first is integrity and authenticity. As a leader, we need to maintain these two qualities in every situation. For patients and their families, we need to honestly communicate the realities of their condition and treatment to help them make informed decisions. This is the function upon which trust is built, without which we cannot lead. Next up is empathy and emotion intelligence. When we put ourselves in the shoes of patients and families, we must not only understand their pain, but also provide emotion support and comfort. It's about whether we can empathize, whether we can make that special connection. My grandfather was diagnosed with gastric cancer before he dies. During the time when he was just diagnosed, the three of us children would listen to my grandfather's stories about his young every day. Perhaps only in this way could he live without regrets. Finally, with over patient listening, my grandfather passed away peacefully and happily. This is also the art of listening learned in Mod 2. Next, let's talk about effective communication. This means we need to communicate complex medical information clearly, while also listening to the needs and concerns of patients and families. Communication is not just talking, but also listening, as I mentioned above. Finally, what we want to discuss is having a clear mission and vision. We as leaders need to have a clear goal of improving the quality and dignity of patients' lives. This is not only a direction but also commitment to ensure that our team members are all working towards the same goal. The next question is, am I the right person? Why? My answer is that I can be the right leader. I'm a senior psychology student and I have learned how to understand and respond to people's emotions and reactions during difficult times in their lives. As a student, I'm ready to practice this knowledge and apply it in practice. So I know how to maintain integrity and authenticity, which is especially important when communicating with patients and families. I understand their emotion and I'm ready to provide the emotional support needed. I understand that communication is not just about speaking out, but more about feeling and responding to the other person's needs. I know how to communicate clearly and empathetically, ensuring everyone understands the truth and challenges they face. Finally, I have a clear goal as a leader to enhance patients' quality of life and dignity. I'm prepared to develop and implement a clear pay of care. So through this message, I believe I can become a leader who can lead the team through difficult times.
In my opinion, putting people first can be the leading principle to solve problems. I think leadership principles are the rules of conduct for leaders. From the perspective of professional medical staff, especially with the principle of leadership as the starting point, the final hospice care for terminally ill patients should be people oriented. It is obvious that medical staff should also improve their self awareness. Treating patients needs to be done slowly and with consistency. Some patients cannot accept the bad news of the serious illness and often take extreme actions. So, in this case, the medical staff should become patient and prepare the patient psychologically. Therefore, I believe that putting people first is the absolute core of all leaders and leadership. Because of tolerance, medical staff will be more patient with patients, and patients will also calmly face their bodies and care about their health because of the tolerance of others.
My name is intd207 and today I will answer the question 4 and question 5. So let's look about the question. What is the most effective form of communication to deal with this situation? Effective communication is at the heart of this approach, ensuring that patients' wishes are respected and that they are fully informed about their condition and their care choices. When communicating with patients, we need to be both effective and honest in discussing their condition, take care of the patients and families' psychological state, and we need to communicate with them about their condition and treatments in a timely manner. When communicating with the team, we need to have regular meeting with the nurses, therapists, uh, psychologists, and staff. This regular meeting is for us to have the same goals and to present our ideas so that we can be more effective in making sure that the team members are on the same page about the patient's treatment and support need. So as medical staff of doctors and nurses, we need to respect the patient's idea and give support for pain man management. So while ensuring that the treatment is effective. and we provide excellent psychotherapy because patients often have psychological problems when they are facing the pain of their illness. We need to provide counseling and support to help patients and their families. We can discuss the fear of facing death, life concerns, and any emotional needs when they may have. And as other social workers, while we are trying to assist with the care, we need to be proactive in addressing issues such as financial problems and caregiving if the patient has them. And in summary, the most effective communication strategy, first based on empathy and honesty, using empathy to understand how the patient is feeling, while at the same time about their condition and other choices we need to be honest. And second one is clarity. In model 2, it has 4CS communication way, which approach to communication states that the key to effective communication is to communicate your purpose clearly. So using clear, understandable language, avoiding medical language, and ensuring that the patient and their family fully understand the situation. They are the key to effective communication. And then actively listen, respect the patients, and communicate with weight and tone of voice, which just means you are respectful, you are conscious, and you still convey your message, but you understand the context in which you are communicating. And this is also the same concept present in Model 2. So after listening to the patients and their families' own thoughts and feelings, we need to be able to be flexible in our tone of voice when dealing with the patients to solve the problem, which is based on honesty. And for example, my parents are doctors, so as for me, as long as it's not life treatmenting, it is for them their situation in their option. And there's one time uh when I have symptoms of shock, they would uphold a professional medical education and treat uh, and counsel me despite their panic. They would talk to me in a joking manner to make me understand my situation. So it eased my anxiety, and after that, other days went on from them. Okay, so let's move on to the second question. How do your values align within the chosen situation? So in the case of my patient who was a lifelong smoker and had advanced lung cancer with only 6 months to live, having the same value is the most important to help get the care team how to provide patient-centered care to ensure that the patient's remaining life is as quality as possible. So how about aligning values? I think the most important values are the following. and which is I looked in core values in Model 1. Before I started, the most important point of value, which I think is values define the culture of any group. So first of all, empathy. In my answer to previous question, I also mentioned empathy. Have empathy allows us to maintain a deep understanding and empathy for our patient's feeling and situation. This is the foundation of our ability to provide care and support. So, for example, because he is a lifelong smoker, he must be very regretful. And I would think that he is in bad in mood. So, we apply a flexible tone of voice that don't aggravate him. And second one is integrity. So honestly communicating with patients about their health status and expectations and maintaining medical behavior is important. This is a point where I believe that patients should have the right to know about their body, so a doctor cannot be lying. And third one is communicate and community. So it utilize and strengthen the resource of patients' community, including family, friends, and support groups, to provide board network of sport. We cannot isolate patients because they need help from family, friend, and community. And then is respect. Respect the aligning values. I think the most important values are the followings, and which is I looked in core values in Model 1. Before I started, the most important point of value, which I think is values define the culture of any group. So first of all, empathy. In my answer to previous question, I also mentioned empathy. Have empathy allows us to maintain a deep understanding and empathy for our patient's feeling and situation. This is the foundation of our ability to provide care and support. So, for example, because he is a lifelong smoker, he must be very regretful. And I would think that he is in bad in mood. So, we apply a flexible tone of voice that don't aggravate him. And second one is integrity. So honestly communicating with patients about their health status and expectations and maintaining medical behavior is important. This is a point where I believe that patients should have the right to know about their body, so a doctor cannot be lying. And third one is communicate and community. So it utilize and strengthen the resource of patients' community, including family, friends, and support groups, to provide board network of sport. We cannot isolate patients because they need help from family, friend, and community. And then is respect. Respect the patient's wishes and choices, whether it's a decision about treatment performance or how they want to spend the rest of their lives. So at the same time, healthcare professional doctors should maintain respect for the patients in their communication. In that case, so that we can communicate better. And the last one is grows. At the end of patient's life, I think we grow the most by putting ourselves in the shoes of the patient and think about how we need to overcome the fear of death and the fear of unknown. So by incorporating these values in our daily routine, such as principles of leadership, how to communication, and so on, it's what can align our values. It is possible to integrate our teams even more.